a lot of them had sort of deviated septums, had surgery by ENTs. It hasn't touched their migraines or their sinus headaches. So are you
And
structurally changing things? Are you changing the mucosal membrane? Are you, I mean, I mean, if you're talking about these numbers, we're talking, Dr. Kevin, this is going to exponentially increase to a degree that we're going to have to somehow multiply you at a rate
I,
that's, no.
I mean, long after I'm gone, it's going to have to continue to multiply. There are 1 billion people in the world that have migraines that can use what I do. So I've got to train ENTs at different medical centers, different medical schools,
Yeah.
so that the whole group can understand how to do it and be able to access more patients.
But why are these
When
ENTs
you,
not seeing any type of change generally with migraines? I mean, if you think about the technique
no,
you developed, I don't know if it
no,
was God inspired or it was totally
it,
revelationary that you decided to
it,
do things differently, but why are they not
I
seeing the
did.
changes?
Well, I don't think people are inquisitive enough and willing to let go of the dogma that we learn in medical school and the dogma that's out there. It's just perpetuating the same thing. And so it always fascinated me that when patients would come in with these horrible CT scans and they had seen 2 or 3 ENTs, I would ask them, what did your ENT say? And she said, well, they either saw something on the scan or they said it was essentially normal. And if they saw something on the scan, when ENTs hear the word migraine, they go, oh no, you need to go see a neurologist. I don't want to, they don't want to assume that responsibility of giving somebody hope that they can get rid of it. I, on the other hand, initially starting out, I'm an ENT surgeon. If you come in with a complaint and I see an abnormality on the scan, I'm going to fix it. And we're going to see what it does. That's how I got to where I am today. I'm a surgeon. I'm a fixer. I'm not well, I see something on the scan. Let's give you some steroid and some antibiotic. I'm not that kind of person. If you have a problem, now if you don't have a problem, then I won't need to do anything. But if you have a problem and you have a problem on the scan, you're going to get a procedure. And the procedure, by the way, takes an hour for me to do it. It's covered by insurance here in the United States. It's 90% effective. No medications, no repeat procedures, no toxins injected, none of that. But it helps those people that I find the abnormalities in. And of course, if they don't have it, then they need to get other things done that can help tremendously. Like I said earlier, the medications, the treatments, the Botox, they're all very helpful for some people. So I'm glad we have that.
Sure.
But the
Now
root
tell me,
cause,
out of those people who don't have migraines that you've done CT scans on, how many of these abnormalities exist in the population? If you take a group, has this been studied or looked at, say,
oh,
300 people?
absolutely. It has been. The incidence of migraine, I mean, the incidence of a deviated septum runs anywhere from 40%, I've heard up to 80%. So people have them. And so, again, there's nothing to do about them unless they're having a problem.
Yeah.
Some are mild, some are medium, some are severe. I've had people with severe septal deviations. And I've asked them, do you have headaches at all? I said, no, I don't get headaches. And I'm surprised, but even in those people, I often think that if a septum is that severe, it probably lacerated the nerve or the turbinate or something and damaged it so bad that they just don't feel it. They just can't. I mean, because it's horrible and they don't have any pain or anything. Yeah.
No, but I mean, like if you had to take a group of 500 people and they
Yes.
had no migraines, and then you
Okay.
had to scan them, would some of
Yes.
those 500 have the abnormalities that you would normally fix
Oh,
that did
absolutely.
present with migraines?
No, it'd be about 40, 50%. Yeah. Or more.
Sure. Wow.
Exactly. That's the incident, but it depends on the degree. A deviated septum can be very minimal to very severe. And so everybody to a certain degree, I say that a normal septum is relatively straight. I mean, I could find something deviated in it because it grows and it gets bumped, that kind of thing. But yeah, you might see up to 40, 50% of those people with a deviated septum to a varying degree. And even if they don't have symptoms, then that's fine. Then you don't need anything done for it. Yeah.
And now,
Very good question.
are you cleaning out the mucus like membrane? Are you changing the structure? Are you cutting away? Are you taking things out? I mean,
That's a very good question. Again, I am doing what I call a normalizing procedure. I'm making your nose normal. People with migraines have abnormal noses, in my case, in my practice, that cause the pain. So what I'm doing is nothing abnormal. It does require a procedure. It does require surgery. However, my surgery is making the septum normal, the turbinates normal, the sinuses normal, so that then your nose functions normally and you don't get the severe headaches. You don't get the bad sinus infection or frequent sinus infections. You don't have sleep apnea anymore. You don't have ear pressure or pain or watery sensation in your ears or vertigo or um, ringing in the ears, tinnitus. All of that's related to the nose being obstructed.